All right. I will be presenting on obsessive compulsive disorder. My client's name is Antonia Watson. That's Antonia Watson. She is 38 years old. My name is Dr. Matt Aida, MattaAita. As far as differential diagnosis, we went with only obsessive compulsive disorder. It fit all the criterion and symptoms perfectly. As far as the primary diagnostic features for obsessive compulsive disorder, there are three. The first one, obsessive thoughts and compulsive behaviors which are distressing to the person. One more time, that's obsessive thoughts and compulsive behaviors which are distressing to the person. The second one, inability to control obsessions and compulsions. One more time, inability to control obsessions and compulsions. Last one, obsessions and compulsions serve the purpose of lowering anxiety levels. Obsessions and compulsions serve the purpose of lowering anxiety levels. All right, so on to the story of Antonia Watson. As I stated earlier, she's 38 years old. So she's a professor, and she has a 5-year history of repeatedly grading and regrading papers. She has, these symptoms where she's retracing her driving route. She's having persistent thoughts of harm coming to her child, and a lot of concerns about her health. All these symptoms, obsessive symptoms, really came about in her college years when she would repeatedly check her coffee maker and curling iron to make sure that they were off and that the house wasn't going to burn down. She says that the symptoms get progressively worse over time, and she begins reading pages in books over and over before exams and writing and rewriting pages numerous times while she's in college. More recently, during the past 3 years, even further escalation in her symptoms. She spends about 2 to 3 hours a day engaging in checking in behaviors, so it takes an enormous amount of her time. She spends at least an hour going back and forth between her curling iron, the coffee maker, and the front door. As far as driving goes, she goes back and forth to make sure that her house hasn't burned down and that a burglar isn't in her house. She checks again and again until finally the internal tension she feels dissipates. So she continuously checks these symptoms many, many times. She also has an issue with her daughter where she provided her 6-year-old daughter with a cell phone. It's a little early in my opinion. And she sends her texts at least once an hour to check that her daughter is safe. And there's times when her daughter won't respond immediately, and she responds, Antonia responds a little out of proportion and frantically starts calling her until she knows that her daughter is safe. Antonia admits that her fear is really unrealistic, but it's almost impossible for her not to engage in these compulsions without becoming excessively anxious and scared. She also has this obsessive ritual of these prayers that she gives at night, praying that her daughter will remain safe. And she knows that, if she were to skip one of these prayers, her daughter would still be safe, but she won't let herself do it. She has to do it. She's now seeking help. Her husband really urged her to get help. And she states how it's really significantly impacting her getting her work done as a college professor. Hard getting it done in a timely manner, And the student evaluations have become fairly negative because of this. So it's really affecting her work as well. So that's Antonia's story. As far as the multi-axial, on the first axis, we chose obsessive compulsive disorder. Axis 2, we have none. Axis 3, we also have none. Axis 4, we have work difficulties. And for axis 5, we gave her a GAF of 65. On to the theoretical perspective, we have 3. I'll try to go slow through these. First one, the biological perspective. Client most likely has elevated cortical cerebral blood flow, which signifies increased levels of the neurotransmitter glutamate, which aids in learning and memory. An overactive amount of glutamate could cause overactive feedback loops, causing someone to check things multiple times. Also, a deficit in serotonin is a possibility, as well as she may have had a genetic predisposition for OCD, obsessive compulsive disorder, sorry. I'll repeat that one more time, a little slower. Client most likely has elevated cortical cerebral blood flow, which signifies increased levels of neurotransmitter glutamate, which aids in learning and memory. An overactive amount of glutamate could cause overactive feedback loops, causing someone to check things multiple times. She could also have a deficit in serotonin, as well as a genetic predisposition. Then we have the behavioral perspective. Client is apparent conditioned as she performs her rituals. She is experiencing negative reinforcement because when the client performs the ritual, the anxiety goes away for a short bit. Finally, we have the cognitive perspective. Symptoms arrive from a distorted perspective. The client sees an overestimated threat as she were not to perform the rituals, and she exhibits irrational beliefs about her safety and the safety of her daughter. All right, thank you guys.